So I'm applying testo gel. It's the bottle version, and all it does is it's synthetic testosterone, and it absorbs into my bloodstream through the muscles, and then I get testosterone.
Miles Pitcher usually applies his testosterone gel every morning before heading to school. Having been assigned female at birth, he's identified as male since he was 14. He came out as transgender to his parents in 2020.
So when he came out as trans to me, I was like, oh, okay. But I didn't really understand it.
We literally just, all of us sat there and talked about it, and that's when the baby boy name website came up.
Miles and his mother searched for a new name together.
Jeff, Tiberius, Steve. Some of the most random names, but it really lightened the mood.
Soon after this, a doctor referred Miles to a youth gender clinic known as the Tavistock. Miles thought he may get counselling and puberty blockers, drugs that pause puberty. As he waited to hear from the clinic, he began his social transition. Dressing like a boy, using male pronouns. He started taking a contraceptive pill to limit the frequency of his periods. He started to wear a binder to conceal his breasts and, on occasion, padding known as a packer inside his underwear to give the look of male genitalia. Years later, he's still waiting. Having heard nothing from the Tavistock, he contacted them earlier this year to ask about his referral. They had no record of it.
When they were like, we have nothing on file for you, we've got no referrals or anything, it kind of just broke my heart, really.
The Tavistock declined to comment on individual cases, but director of its youth gender clinic, Polly Carmichael, said in a statement that it had been an exceptionally challenging couple of years for our patients and their families. Miles is not alone. He's one of at least 8,000 young people in England and Wales waiting to receive transgender care from the NHS, Britain's state-funded National Health Service. That's according to a Reuters review of NHS documents. The UK government had promised an overhaul of the youth gender care system after it was deemed inadequate by England's regulator of health and social care. Some clinicians had complained that the Tavistock, England's only state-run youth gender clinic, was too quick to offer medical treatments to young people.
Beautiful, beautiful.
Families said its huge waiting lists were unsafe, and transgender rights advocates have asked the British High Court to rule that they were unlawful. The new plan, announced by the NHS, was to close the Tavistock and replace it with regional centres to better accommodate a fast-growing patient population. But the reality is already falling short of those ambitions, hobbled by a toxic political climate. More than 1,500 recently referred young people are being kept on a new waiting list for the future centres, with no sense of when they'll be treated, NHS sources told Reuters. The NHS told Reuters it is expanding healthcare services for young trans people and is also working on better supporting those on the waiting list. Dr. Marcy Bowers, a gender surgeon and president of the world's leading transgender health organisation, WPATH, told Reuters that barriers to transgender care are going up after 20 years of trying to reduce them.
When you're treating a young person, it feels like a greater weight of responsibility to get it right. So you do want to get it right. You don't want a person who's going to go through life unhappy. But as clinicians, we see these patients every day.
Like, it sounds extreme, but it's like the NHS has kind of failed me as a trans person, because I feel like I'm just left in like a limbo of no one really knows what to do.
Eventually, Miles looked elsewhere for help. It took just 1 week after Miles's first full appointment for an online clinic, Gender GP, to agree to prescribe testosterone. Its prescribing doctors are all based overseas and regulated within their home countries. But its British founders have been sanctioned by official medical tribunals for gender care they provided since setting up their online clinic in 2015.
But it was a lot of research into them because of a lot of the news articles surrounding them.
Michael Webberley was struck off the medical register while Helen was suspended. Neither currently do clinical work for Gender GP. Both deny they failed their patients and appealed, although Michael's appeal was dismissed by the High Court in December.
We should provide trans healthcare in the same way that we provide all healthcare. And that means all ages, all colours, all genders, all sexualities, all abilities. Everybody needs healthcare. So to kind of partition off the young people and say you don't need this care would be absurd.
Miles, a keen rugby player, is attracted to boys and hopes to study archaeology at university. While he and his parents say they're happy with Gender GP, they worry the lack of NHS care will lead young people to unscrupulous online providers or even to self-medicate.
I think with all of the review and everything, they need to remember that people aren't just numbers, that all these people on the waiting list are actual, children.